The rotator cuff is composed of 4 different tendons, and this is a 3D model of the rotator cuff. So this is the subscapularis tendon of the rotator cuff, supraspinatus, which is the most commonly torn, infraspinatus here, and teres minor. The rotator cuff muscles allow you to rotate the arm. In addition, they allow you to elevate the arm and give you power and strength, in addition to the deltoid. Over time, unfortunately, this bone here, called the acromion, which others call a bone spur, can rub up against and impinge against the rotator cuff. And after many years, that spur can cause enough impingement to cause a tear in the rotator cuff where it tears off the bone. And if it tears off the bone in this fashion, unfortunately, it won't heal itself. And so, for the most part, we're pretty aggressive about recommending repairs for the rotator cuff if it's a complete tear. And then, if it's a complete tear, the question is, how big of a tear? Is it small, medium, massive? Sometimes you can treat partial tears conservatively, and I'm pretty conservative with partial tears. It depends on the patient. Usually younger, active person wants to be a bit more aggressive. Older, more sedentary person is willing to be more conservative. And physical therapy can help make a person feel better. It might not give them as much strength if the cuff is torn off the bone, but it can be helpful to some degree. So it's just another way to understand the cuff. If the cuff is here and it's torn off the bone, the blood supply to feed the cuff comes from here, the bone. So the cuff that's torn off doesn't get any blood supply. It can't really be fed, and so it doesn't really work very well after a time. So that's the risk you take if you don't have it repaired. And nowadays we can do arthroscopic repairs, which is better, but it's still surgery. And so it's important to have a thorough discussion with your surgeon if you have a rotator cuff tear as to whether it's partial or complete. If it's complete, how large it is, and what are the risks and benefits of having surgery. If you decide not to have surgery, that's okay. The surgeon should tell you what your expectations should be. If you do have surgery, that's okay as well, and he or she should also be able to tell you what the results should be. Either way, you'll do well.